Welcome to H&HN Daily. I'm Susanna Hopsalerin, Senior Editor for Hospitals and Health Networks magazine. The Veterans Health Administration is the nation's largest integrated healthcare system, serving more than 8 million veterans. Since 2010, veterans have had access to their healthcare records electronically. By giving patients control of their data, patients are more involved. Today, I'm joined by Dr. Robert Petzel, Undersecretary for Health in the Department of Veterans Affairs, to discuss Veterans Health Administration and empowering patients. Welcome, Dr. Petzel.
Thank you.
The Veterans Health Administration has been an early pioneer in the electronic health records, CPOE, closed-loop medication administration. How has this improved the quality of care that our veterans receive?
Well, the electronic record and the parts of it that you mentioned earlier have dramatically improved, number one, the safety of administration. We no longer are transcribing orders, particularly medication orders, 2 or 3 times before they reach the pharmacy and then get back up to the patient. And the medication errors have dramatically decreased as a result of that. But probably the most important thing is that it is a patient management platform. It has greatly enhanced the capacity of providers to manage their patients. The data is all right there. The data historically is all right there, and one can follow laboratory medications, patient parameters over a period of time, and I do a much better job of managing patient care.
How has the patient's control of their data improved their involvement in their care?
We believe that patients should be in control of their health care. And we also believe that the first priority in patients being in control of their health care is having access to their medical record. So it is fundamentally important. If patients are going to control and drive their health care, they have to have access to their medical record. And the fact that we have this complete electronic record across our entire system, inpatient and outpatient, means that at literally the press of a button, a patient can have available to them their entire electronic record. And it is the first step in empowering patients to take control of their health care.
Does it change the conversation between the patient and the caregiver?
Yes, it does. There is a shift in power, if you will, from the provider being in power and empowered to take care of the patient to the patient being empowered to provide for and to participate in their whole healthcare. So it does very much shifts the conversation away from the provider being in control to the patient being in control, and even beyond that, driving their own healthcare.
What can the rest of us learn from the VHA experience in working with patients with chronic conditions and even providing care within the home environment and to families?
In our patient population, we estimate that about 4.5 million of the patients we care for have multiple complex chronic diseases: hypertension, obesity, chronic obstructive pulmonary disease, congestive heart failure, COPD, and a variety of other things. And these patients require, first of all, the medical record is a valuable tool in making sure that you're caring for a patient as opposed to caring for just a particular disease. Secondly, we believe that many of these patients will benefit from some sort of telehome health activity or device. It may be something as simple as a patient with congestive heart failure having their favorite chair with a scale in it, so that each day in the morning when they sit down in their chair, their weight is transmitted back to their provider team, and they can watch to see if this patient is gaining or losing weight as a result of their either medication or under medication of their congestive heart failure. That's just a simple example of the kinds of things that these patients with chronic diseases can benefit from. Monitoring blood glucose and diabetes, being able to transmit an EKG back to the provider from the home. These things will keep patients out of the hospital. They'll reduce the need for clinic visits, and they'll certainly reduce the need for emergency room visits, and we think are going to have a very positive impact on the cost of care as well as the quality of the care that's being delivered.
What challenges and opportunities do you see in the future?
And we believe that patients want several things, and one of them is to be connected to their healthcare system and or to their provider. So I think that one of the future things that we're going to see is a tremendous increase in the connectivity that patients have with their healthcare team. Telehome health is an example of that. Mobile devices are even a greater example of that. Patients are going to want to be able to communicate whenever they feel a need to with their provider team and with their healthcare system. And that means then that providers are going to have to be able to manage this information. I mean, they're going to be getting a tremendous amount of information back from patients. So the capacity to manage, mine, and distill that information into a package or packages that the provider can easily digest, I think is going to be very important. I think the monolithic medical record that we know now is going to disappear. And we will have a medical record that's a series of work streams on mobile devices, not this big centralized, totally integrated medical record. There's a revolution going on here. There really is. And it involves empowering patients and involves connecting patients to their healthcare system and their healthcare provider team.
Thank you for joining us today.
Oh, thank you. It was my pleasure.